Greetings. Well, let's see. September 18, Monday, 2023. My name's Clint Burton. I guess in part this is about documenting a certain set of experiences. You know, I've got the adjusting for light, the fluctuating light. In 2010, I received total hip replacement, which was actually a revision from a resurfacing surgery back in that I had in 2008 for my right hip. For the resurfacing, the acetabular cup was loose for 20 months, and then, at about the 20-month mark, I had a revision surgery, and at my request, the X-ray findings did not show any loosening. The particular cup, I don't know if I'll name it at this moment. Again, this is just the beginning, figuring what I want to do here. But the fact that I'm in the process of waiting for the testing, the unique yet not so unique. I don't know how many others out there have a delta ceramic on ceramic. So my ceramic on ceramic hip is 13 years old. I got the implant. Okay, so how about this? So 29 years old, got my resurfacing. 20 months later, revision. So resurfacing to a total hip replacement, which I wasn't happy about. The recovery was not. It was a very difficult recovery. Those again, just it's not about getting into everything here, because I believe somebody's going to end up finding this, and then there's going to inevitably be questions, because I remember researching what's the word? Voraciously myself for others' experiences, because it just this idea of, is there a possibility of hope, especially coming from an athletic and a type of competitive background. Sorry for I don't have the auto feature at the moment. I'll keep that in mind for next time. So just bear overfocused, underfocused. Bear with me. But at least, hey, this is a start, I think, something positive. Yeah. Okay, so what's going on? So considering my right hip is now made up of good old five components. So from a stem, the femoral stem, the neck, the femur head, the acetabular liner, and then the acetabular shell. And what I believe is going on is I've cracked, to whatever degree, the acetabular liner. So remember, this is delta ceramic on ceramic. This is the delta version, so the pink, not the previous, the alumina, which there were issues. I had initially requested a metal on metal device for the revision. The surgeon, it was kind of like a last minute ambush. He was uncomfortable with implanting another metal on metal device, and the facility was not even comfortable at that time doing resurfacings, but that was my situation, and I needed a revision. It was 20 months of a kind of hell I wouldn't wish on anyone. And anyway, it's been a fascinating experience. So I've been able to at least walk 13 years. It's been a difficult 13 years, but I got this far. So nonetheless, okay, I guess I'll keep this in part relatively short for video number 1. Anyway, back to what can I tell you? I have the 36 millimeter femoral head. I'd requested a larger size because of my age and my desired activity levels. But I was given a 36 millimeter femoral head, a 63 acetabular shell, and whatever the corresponding liner would have been. So a very thick ceramic liner, robust liner. In part, I'm glad that the surgeon made those choices. So opting for the smaller, I think I'd requested nothing smaller than, I don't know if it was whether 38 millimeter was an option, but 40 to 42 millimeter I had asked for if it was a possibility for a femoral head, and then of course the corresponding liner. But I got the 36 millimeter femoral head, Delta ceramic, and the corresponding liner that would fit into a 63 millimeter shell. I could give details. Yeah, maybe that's another time, and if I get the questions. But it's at some point I'll post this, and then somebody, again, just expecting, because I know there are others out there. And so I've had experiences over these last 13 years. I had a breakdown with my relationship with my surgeon, the last surgeon from 2010. He's since retired, and what do I say? Whenever there was what I thought or felt like was an issue, I thankfully, having a good family doctor, requesting just a basic x-ray, just to make sure everything mechanically. I did have soft tissue issues, but mechanically, just making sure everything mechanically, nothing was coming loose, nothing had happened to the ceramic. Yeah, so what now? So for the last, so let's say once a year, or maybe once every 2 years, I'd get an x-ray just for my own peace of mind, because something would have inevitably happened. There'd be a sound, there'd be a feeling, and it'd be like, on top of the other sounds and feelings. If you have a ceramic on ceramic, I think there's the inevitability of also the having a dry joint, and if it's positioned right, I think the squeaking is minimized. Yes, there have been cases of consistent, constant squeaking. Thankfully, I didn't have that issue. I did have that issue in certain instances. If I'd been, say, standing for a long period of time in a certain position, even. Again, if questions come up about this, I have no problem talking about. And then it would the inevitable, not just sometimes there would be the ceramic on ceramic squeal, or of a unique vibration which resounded. It just literally went to my bottom of my feet to the top of my head. It was a fascinating experience. I didn't look forward to it. First few times it happened, it was disgusting to experience, and then Yeah, wow. Anyway, what's been going on? I think, like as I had mentioned, I believe I've cracked the, or maybe not that I've cracked it, but I think the acetabular liner, something's gone on, because there's the deep, again, the deep, there's the deep pain, discomfort, the ache, but also the experience of that dry, instead of having, remember, motion is lotion. When there's motion, there's that thin film that, so the two surfaces never touch. And then I've been having these experiences where the two surfaces are touching often, whether it's as basic as going upstairs or certain movements. And then that combined with the ache, it's like, okay, that the synovial fluid is dispersing somewhere. I can still walk, so there's no catastrophic event. I haven't had a dislocation. My leg length, as best as I can tell, it's it's the same as before. So it tells me that the femoral head is still intact, because obviously if the femoral head fails, that's a totally different story. That'd be emergency room because of a dislocation and further damage, dislocation, whatever. Anyway, that's not the case. So going through deductive reasoning, this is what I think has happened. And then I've got thankfully a CT scan coming up in October, because the basic x-ray showed everything's fine. So, which in part, this is the motivation and impetus to also document, because again, this idea that we're in part walking experiments. What are the symptoms, and especially to have a testing process that there was already a stonewall happening where, well, the basic x-ray showed nothing, your patient's fine, we don't need to further test. And if you don't have a strong advocate in your corner, it can be difficult to further this process. Or in certain cases, depending on what country you live, there's the potential, the out-of-pocket expense for either a private test, or if it's a like where I live in Canada, the medical services, there's that's another story. But why am I forgetting certain names? Services are covered, but it's essentially get in line, and it could be a year plus. And unfortunately, I was being a part of the system in my youth. I had to sit through that system, and in that interim of waiting, certain further damage was done, which led to having to have a resurfacing in the first place, or a laparoscopic surgery, so a corrective type surgery, soft tissue and bone, and that degeneration had taken place enough at that point that I started having issues where I did need to have a hip replacement. Thankfully, I found the resurfacing community and made a friend in the late Vicky Marlowe. And I'm sure, that's another story. But anyway, I'll leave it at that. This will be number one. So again, just waiting for the testing process, and the patient coming forward, trying to document the experience of, I believe I've cracked the ceramic liner, or my ceramic liner is cracked, and because of the loss of the fluid, the synovial fluid film that in regular motion is present, and yet it's dispersing in a way that's allowing the two surfaces, so the femoral head and the acetabular liner, to come into contact. So, or the liner's dislodged, I don't know, but that's the point. But thankfully, October, testing. But I think in part there's also the intelligence of our intuition, of knowing our inner world. We're familiar enough with pain, discomfort, this idea that something's different. It's not just is it? No, something's different. Something's changed, and it's not good. Anyway, I'm Clint Burton, Western Canada. Blessings wherever you're at, and if you find this, yes, and whatever time, whether it's the day it's posted, the day after, weeks after, or even the years. I remember the experience back in 2007, 2008, finding other, in Canada, even back east, other patients that had had the resurfacing experience. And getting some very making positive connections and getting positive feedback. So anyway, just want to start this process. Okay, so until this is the video one. Wow, here we go. Bye for now.